Hey everyone, it's Rachel and Lauren here, co-op students at Goldsworthy Wellness, and today we're going to be wrapping up Heart and Stroke Month by making a video talking about the signs and symptoms of heart attack and stroke, and then we're also going to be giving you some simple first aid tips to help out if you ever see anyone suffering with a heart attack or stroke. So let's get into the video. First, we're going to start off with heart attacks. So what are heart attacks? What happens is a blood clot occurs in the coronary arteries, and the coronary arteries is what supplies the heart with blood. And so when it gets clotted, it's not able to get the oxygen that it needs. So a certain area of the heart ends up dying. So now we're going to talk about some symptoms of heart attacks. One of the big ones is increased pressure in the chest. Nausea is another one as well. Indigestion, shortness of breath, cold sweat, fatigue, and lastly, denial. Now we're going to move on to stroke. So what is a stroke? What happens is, instead of the blood clot being in the coronary arteries, the blood clot occurs in the blood vessels in the brain. So the same idea, a certain area of the brain can't get the oxygen that it needs, so the areas that it's responsible for, so whether it's motion or memory, gets impaired. That's why some of these symptoms of stroke that I'm going to talk about next occur. So one of the big ones is the sudden numbness or weakness on some of the limbs. So arms, legs, or face. And normally this happens on one side of the body. So if the blood clot is occurring on the right side, you're going to get the effect on the opposite side, so on the left side, as you can see in this picture. So next, another one is trouble walking, dizziness, or loss of balance is another symptom. Sudden confusion or trouble speaking, sudden blurred vision in one or both eyes, facial drooping on one side. And next we're going to move on to talk about some first aid. So you can use this if you ever see anyone suspecting to have a heart attack or stroke. So first, what we're going to talk about is ABCs. So this is a vital sign check. ABC stands for airway, breathing, and circulation. So you can check the airway by putting your hand over the person's mouth, and then you can also look to see if you can see the rise and fall of their chest moving. You want to make sure that they're breathing correctly, not coughing or wheezing, and then you check their circulation by checking their pulse, or you can press their finger and see if the blood returns back to it. So one of the big things is determining. So we want to make sure that you're looking at the environment around you and making sure that they're not just having some of these symptoms because they're tired from a race or something like that. So you want to assess their symptoms. You can use the acronym FAST for stroke. So FAST stands for facial drooping, arms, speech, and time to call. So if any of these symptoms are occurring, it's definitely time to call EMS. Don't hesitate. If you suspect someone's suffering from a heart attack or stroke, you want to make sure you call 911 right away. And while you're waiting for them to arrive, what you can do is make the person more comfortable. So you can loosen any tight clothing that they might have. You can also offer them an aspirin if they're having a heart attack, so that way it can thin out the blood. And then lastly, you want to make sure that you're checking the ABCs as often as possible, making sure that they're still okay. If it gets worse, make sure you call EMS back just to update them on the situation. So I hope you enjoyed the video. Thanks so much for watching. Make sure to subscribe to our YouTube channel or check our Facebook pages for more updates. As always, Dr. Jeff's got your back.